first clinic in Eastern Europe who started screening of embryo for all chromosomes. For now, we have two different types of so-called next generation sequencer, Thermo Fisher and Illumina. It's two different separate platforms, and we can use both of them for embryo testing. Second field, it's a so-called non-invasive testing of fetal abnormalities. We talked about this previously.
Yes.
So-called NIPT test. And last one is so-called whole exome sequencing, when we can sequence so-called genetic read up to 20,000 of genes from the person in one run of machine, and we can detect almost all types of genetic diseases, of all types of chromosomal abnormalities using our approaches.
Hello, Dmitry. I'm very excited to meet you. Tell me, please, how many % of couples refer to you with a problem of infertility?
I think that at least 10 to 15% of women meet this problem in their fertile history.
And what is the % of genetic problems?
Infertility condition is a multifactorial disease, so it caused by many different factors, starting from infection disease and ending by genetic causes. And genetic causes is in infertility. It's only a small part of all infertility problems. It's 5 to 7%, not more.
Modern genetic is a way, how do you think, to overcome infertility or to prevent genetic diseases of a child?
I think it will be good to divide this question
into two parts.
Two different parts. When we work with a couple, for example, with chromosomal abnormalities like translocation, inversion, and so on. In our case, infertility treatment allows us to overcome this problem. To reach healthy embryo, followed by embryo transfer and pregnancy. If we work with a couple with high risk of genetic pathology, we can talk about so-called recessive gene condition, when couple are carriers, hidden carriers of genetic mutation, and they have, for example, 25% chances to have a sick baby. In such cases, we can use IVF and genetic testing to prevent this pathology and to reach the healthy baby born.
How do you think 25% is it is considered to be a high volume of percent, or it is normal? How do you think?
It's very high.
It's very high.
But in some condition, this risk can reach up to 50%.
Oh wow. It is considered to be that the age of 40-45 years is a high risk of miscarriage for women. Does selection, for example, help to choose a healthy embryo for a couple?
Yes, sure. We can talk about so-called age-related chromosomal abnormalities of oocytes, and that's why we receive a great part of embryos with chromosomal abnormalities. Embryo testing is only one way to detect if the embryo has normal or abnormal karyotype, and we can only select. We cannot create. We can only select normal embryo and transfer this embryo.
Okay, I understand. And what about the risk? The risk for the embryo during biopsy? How do you think?
If we talk about good quality embryos, we have no risk. This risk can be used in a case of low quality embryos. And I should tell you that we have different types of biopsy. The most harmful biopsy is so-called blastoma biopsy, because this procedure connected with 1/3 part of loss of their implantation of embryo implantation potential after biopsy. In our practice, we use so-called trophectoderm biopsy. We collect cells not from inert cell mass of embryo. We use trophectoderm cells. Trophectoderm biopsy is the most safety way to receive cells from embryo.
Is the percent of carrying pregnancy increasing? Because for mother, it is the big stress.
Sure. We should talk about different clinical groups, because in our clinic we propose this testing for high-risk groups, and in that risk we have our own statistic, and we can be sure that in their case it will be safety and it will be most effective procedure. If we're talking about general population and low risk patient, in such case we cannot guarantee that this testing will be useful in their case. So only in specific clinical condition we can use embryo testing, not for all patients.
Okay. What about the accuracy? What is the accuracy of genetic research?
It's more than 99%. Sure, we cannot exclude a genetic condition that can appear after fertilization. It's so-called mosaicism, when different cells of embryo can have different genetic abnormalities or different types of karyotypes. In such case, we cannot detect status of separate cells. But in general, the main goal of embryo testing is to exclude embryo with wrong karyotype.
So the amount still successful?
Yes, it's more than 99%.
Yes, that's a great number. And tell us, please, about the discoveries of genetics that seemed impossible far back than 10 years ago.
I can describe 3 clinical situations with such genetic successes. First of all, it's embryo testing for all chromosomes, because before that we can use so-called fish method, and we can detect only sex chromosomes or only chromosome 21 for Down syndrome, but now we can use testing for all chromosomes. Second way is so-called non-invasive testing of fetal chromosome abnormalities using the blood of pregnant women, without invasive procedure like chorion biopsy or amniocentesis. We can collect blood, peripheral blood from pregnant women, and we can detect if the fetus has a chromosomal abnormality. And last field, we live in very interesting time, and in our time true. We only try to discover new drugs against genetic pathology. So for now we can cure only several types of genetic condition. It's a so-called genetic therapy. It's too expensive, but it's for great number of people is only way to keep their life.
Wow, that's great. Really amazing. And why are you personally involved in this process of genetics? Why are you so excited about this?
I was interested in a job that can include successes from different specialties. It's a medicine, biophysics, biochemistry, physiology, and genetic, and so on. So for now, genetic is not only clear genetic. To be a geneticist in our time is to be a geneticist, to be a little obstetric and gynecologist, is to be a little physiologist, biochemist, and so
you
on.
are a little bit obsessed, so to say, about this, yeah?
Yes, we can say so.
Okay, thank you, Dmitry, for your time, for your very interesting speech. Thank you. It was very interesting for us and for our audience. Thank you.